name is Seth from the Center for Thyroid and Parathyroid Surgery, and in this video we will be discussing a hemithyroidectomy. A hemithyroidectomy is to remove one side of the thyroid. Reasons to perform a hemithyroidectomy are to remove an enlarging but benign thyroid nodule that's causing compressive symptoms, difficulty breathing or swallowing or pressure in your neck. Also for benign or enlarging goiters or enlarged thyroid glands. Also for thyroid cancer or a toxic thyroid nodule or hyperfunctioning thyroid nodule. Now for thyroid nodules, we do not remove just the thyroid nodule from the thyroid gland. We don't carve a nodule out. The reason being there's a high chance of leaving that nodule behind, and especially with cancer, there's a high chance that that cancer could come back. And a second stage surgery is very complicated because of the scarring and inflammation from the first surgery. So our guidelines from the American Thyroid Association recommend that we remove the entire side of the thyroid. Again, that's called a hemithyroidectomy. This surgery is performed under general anesthesia in the operating room. That means you get an IV medicine that goes through the IV and you go completely asleep. Once you're asleep, put a breathing tube down the windpipe to breathe for you. I use a special type of breathing tube that allows me to monitor the nerves, your vocal cords, and I will explain why that's important in a little bit. In order to perform the surgery, I make an incision low in your neck in a natural horizontal crease. I do specialize in minimally invasive approaches, which means making the smallest incision possible to take out the one side of the thyroid. Now, the size of that incision depends on the size of your thyroid lobe. Usually that can range anywhere from 4 to 6 centimeters, and typically I can make about a 5 centimeter incision or a 2-inch incision to remove the side of the thyroid. Now, if your thyroid nodule or goiter or thyroid lobe is bigger than that, then your incision may need to be bigger. Also, if you have a larger neck, it may require a larger incision. It takes about an hour to an hour and a half to remove one side of the thyroid. Once I finish, I close the incision with a few stitches that go beneath the skin, which will dissolve on their own. On top, I use blue skin glue and white bandages embedded in the skin glue. The nice thing about that type of bandage is you can get it wet. So the night of the surgery or the next day, you can take a shower, letting soap and water run over the bandage, no scrubbing, pat it gently dry with a towel. This bandage stays in place for 2 weeks. If it's on any longer, you peel it off. So very simple and easy to take care of. Sometimes the bandage falls off before 2 weeks, not a big deal. You just leave it be. Once the bandage is off, you can scrub the area like normal. You'll also notice a few bumps along the incision line. Those are the deep stitches that haven't dissolved yet. I promise you with time those bumps will go away. Before you wake up, we take the breathing tube out and watch you in the recovery area. As long as you are healthy without any significant medical problems, and as long as your pain and nausea is controlled in the recovery area, you should be able to go home the same day of the surgery. We call that an outpatient surgery. Now, if you are elderly or have significant health problems, or are traveling from over an hour away, or do not have anyone at home to help watch you the first night of surgery, we would have a low threshold to watch you overnight in the hospital and then discharge you home early the next morning. If you were to go home the same day, I would call you the next day to check in on you, answer any questions you might have. I would also call you in 2 to 3 business days after the surgery with the results of the pathology report. And then you have an appointment to come back to see us in about 6 weeks. At that appointment, we make sure everything is healing okay. We also ask you to get some blood work just before that 6-week appointment. And that blood work is to measure your thyroid hormone levels. When we remove one side of the thyroid, 70% of the time, the remaining half makes enough thyroid hormone for your body to be happy. 30% of the time, that's not the case. You may develop hypothyroidism. If you are part of that 30%, you would require a once daily thyroid hormone medication to treat that hypothyroidism, and we would have those results just before that 6-week appointment. Recovery from this surgery is about 5 to 7 days. During that time, you will have pain and swelling around the incision, as well as a sore throat when you swallow and hoarse voice when you speak. Most patients do just fine with Tylenol and ibuprofen alternating between the two of them, as well as ice packs and sore throat lozenges. I do send you home with a few low-dose narcotic pain medications just in case you need something extra. If you do, it's typically just the first night, maybe until next morning, usually not much long after that. I also send you home with a anti-nausea medication that dissolves underneath the tongue. Sometimes a general anesthesia can cause nausea and vomiting, And I don't want you throwing up because A, it's a miserable experience. B, it can also increase the risk for bleeding inside the lung following the surgery. I send those 2 prescriptions electronically to your pharmacy that's on file, and you can pick those up on the way home. I do ask that you take it easy for 1 week during your recovery, avoiding any strenuous activities that would elevate your heart rate or blood pressure and increase the risk for bleeding inside the wound. That means no running, no jumping, no lifting heavier than 10 pounds. After 1 week, there are no restrictions. You can do whatever you like. Throughout your entire recovery period, there's no restrictions with the positioning of your head and neck. You can sleep and relax in whatever position is comfortable for you. Even though you will have a hoarse voice, there are no speaking restrictions, I should say. You can talk as much as you want. Because of that sore throat, I do recommend you start off with liquids and soft foods. You can go to solid foods as soon as you tolerate. That may take 1 to 3 days. You can drive once you're off the strong pain medicine, and once you can turn your head and neck to check your blind spots without hesitating. That takes about 1 to 3 days as well. So essentially taking it easy for 1 week. Again, no vigorous activities to get your heart rate up or blood pressure up. You can still do things around the house. You can walk up and down stairs. You can even run errands once you can drive. I typically recommend 1 week off of work following the surgery if you work a very strenuous job, manual labors, and sometimes 2 weeks. The risks for this surgery include what we already talked about a 30% chance that you could develop hypothyroidism or low thyroid hormone following the surgery. You may need to be on a once daily thyroid hormone medication for the rest of your life. Again, we would know that after we get the results of your blood work, measuring your thyroid hormone levels 6 weeks later. Next is risk to injury to a nearby structure. This is called the recurrent laryngeal nerve. This runs right behind the thyroid gland and controls the movement of your vocal cords and your voice. It's very important that I find this nerve and protect it during the surgery. That being said, sometimes the nerve can be stretched or over manipulated, and that can result in a temporary weak or hoarse voice that can last several days, sometimes up to 9 months. Thankfully, this risk is low, 5% for a temporary weak and hoarse voice. There is a 1% chance that nerve can be severely injured and never recover. If that were to happen, it could potentially result in a permanently weak and hoarse voice. Again, this is very rare. Only happens 1% of the time. If it were to happen, there is a second procedure that can be done at a later date and time to help bring that voice back to pretty close to normal. Conversational voice would be the same, but singing and yelling would be off just a little bit. And thankfully, the risk for a permanently weak and hoarse voice is very low, 1% of the time. Now, your risk for these injury to the nerve do go up with a larger goiter or a goiter that extends into your chest, like a substernal goiter, and sometimes with presence of thyroid cancer. There is an accessory nerve to the voice box called the superior laryngeal nerve that helps control pitch and projection. This nerve similarly can be injured and result in a temporary change in your pitch and projection, which could last several days, sometimes up to 9 months, and about a 5% chance that it could be permanent. Next to the risk of any surgery, that includes infection. That risk is very low, about 1% or less. You do get antibiotics at the time of surgery. You typically don't need anything else afterwards. Risk signs of infection would be swelling, redness, pain around the incision site. Next are the risk of bleeding. There's a 1% chance that you could have bleeding following the surgery. Sometimes one of the blood vessels I have to seal off in order to remove the thyroid could open up afterwards. Signs of bleeding would be swelling your neck like a bullfrog. Sometimes that bleeding stops on its own. Sometimes it doesn't. I have to urgently take you back to the operating room to control that bleeding, which could, in some cases, be life-threatening. It takes about a whole week for those blood vessels to completely seal off. So that's why I ask you to take it easy that first week. I don't want the blood pressure up or the heart rate up to cause one of those blood vessels to open up before it's completely sealed off. Next are the risk of general anesthesia, that's putting you to sleep. So long as you are healthy, those risks are fairly low. You do require that you get cleared by your primary care physician. If you have any significant heart or lung issues or any other significant health condition, we may ask you to be seen by that other specialist to be cleared as well. Next are the risk of scarring. As I mentioned, I try to keep the incision as small as possible, hide it in a natural crease. Ultimately, it's up to your body and how you heal. As long as you don't have a history of keloids or hypertrophic scarring, usually this incision heals nicely. I perform the surgery here at Central Page Hospital. For any more information about left thyroidectomies, any other type of thyroid or parathyroid surgery, any other topic on the thyroid or parathyroid glands, please visit my website at sethkaymd.com. That's SETHKAYMD.com. Thank you for listening.